Today is June 18th, 2024. Welcome to our conversation with our guest tonight, leader of the Conservative Party of BC, John Rustad. My name is Philip Davidson. I'll be your host for this evening. For those of you who are joining us for the first time tonight, and for our audience who will be watching us later online, a bit of background on who we are and why we convene this meeting. I'm coming to you as the president of the BCPS Employees for Freedom Society, a nonpartisan, not-for-profit society of current and former BC public servants who stand for medical privacy and bodily autonomy. We're joined tonight by members of the United Healthcare Workers of BC, another not-for-profit society that stands for medical privacy and bodily autonomy, as well as in defense of patient care in BC's public healthcare system. Several weeks ago, both of our organizations together reached out to the leaders of BC's four main political parties, including Premier David Eby, John Rustad of the Conservative Party of BC, Kevin Falcon of BC United, and Sonia Furstenau of the BC Greens, to invite each leader to a forum to speak with our members in the lead up to the 2024 BC general election on October 19th.
Ladies and
Well,
gentlemen,
while we
this
are a
is a
nonpartisan
non-recording call for
organization and do not endorse any particular political party, we are very interested in matters of public policy and impacts on public services. As professionals who have been tasked with providing public services and delivering on government's agenda to support British Columbians, we would like to know where those vying for political leadership of the province would like to take us. We are particularly concerned with the erosion of individual civil liberties in recent years and would like to know where parties and candidates stand on issues of medical privacy and bodily autonomy. Our advocacy work also extends to supporting and fundraising for ongoing class action litigation against the government of BC for violating the medical privacy and bodily autonomy of public servants and healthcare workers through the imposition of punitive proof of COVID-19, no jab, no job vaccine mandates that have harmed tens of thousands of BC workers since 2021. This is a challenge that public sector unions in this province have utterly failed to take up, and so we are grateful for your support and donations that allow us to pursue government accountability for these unnecessary and egregious actions that have done so much harm to workers in public services in BC. We will have a legal update for BCPSEF and United Healthcare Workers of BC members on the status of the two class actions supported by our respective societies after the conversation with our guest tonight. So stay tuned to the end. So tonight we'll have our conversation with the first party leader to accept our invitation, John Rustad. I will interview our guest first, and then we will invite your questions at the end. Please remain muted until we have invited your questions, and we encourage you to do so, write your questions in the chat, and we'll read them out. So our guest tonight is member of the Legislative Assembly of BC for Nechako Lakes, John Rustad. He was born and raised in Prince George and has spent all his life living in northern BC. John was first elected as MLA in 2005 and later served in cabinet with the BC Liberal government as Minister of Aboriginal Relations and Reconciliation and Minister of Forest Lands and Natural Resource Operations. In 2022, Mr. Rustad parted ways with the BC Liberal Party in opposition and sat as an independent MLA before joining the Conservative Party of BC. On March 31st, 2023, he became the Conservative Party of BC's leader. Mr. Rustad, John, if I may, welcome. How are you doing tonight?
Thank you very much, and thank you for having me on. I apologize for being in an airport, so it might be a little noisy in the background, but such is life. It's a very busy schedule these days.
I can imagine, and thanks for taking the time to meet with us and meet with our members. We appreciate your time. And so we like to get to know our guests a little better first. We did share a little bit about your biography, but what specifically inspired you to get involved in public service, to become involved in politics?
Sure. Well, first of all, I just want to see that Suzanne Anton has joined, and of course, former Attorney General and colleague of mine when I was with the BC Liberals. I just wanted to take a second to say hi. So,
Thanks,
what
John.
got me into
Hello.
politics? What got me involved in politics? Back in the 90s, I was running my own company, never thought about politics as a career. I was so unhappy with where things were going in the province. I sat down with my wife in the year 2000 and talked about moving to go Calgary. moving my company and my business to Alberta, just because it would have been much easier, and the profit margin would be about 15% more right off the top. So we had a very long conversation about politics and about the two provinces. Ultimately, my whole family was in Prince George. Our parents were in Prince George. I was involved with a number of other things, and so we decided to stay in British Columbia. Well, that left me with two choices: either live with it or get involved and try to change it. And I'm not the type of person that just likes to live with it when I see something that I don't like. And so I decided to get involved. So after a short period of time, I discovered I actually enjoy politics, which is why I'm still involved in politics and still doing what I do.
And it's been quite some time, and you've been going through a lot of changes, and there's been some interesting things happening, certainly with you and your party. And I want to get to that a little bit later. Um, but as I mentioned, we are going through a time of great change in politics, and BC is no exception. Um, it seems like the seeds for this change were sown by events that began at least 4 years ago with the onset of COVID-19. And in 2020, governments all over the world, and not just in Canada or BC, began to govern in a much more illiberal and authoritarian way. Lockdowns, shutdowns, restrictions, mandates, fines, penalties, punishments for practicing civil liberties and asserting charter rights became commonplace and part of our everyday lives. Of course, governments claimed that all of this was necessary and done in the name of public health and safety. Um, but this authoritarian turn really culminated in Canada with the federal government's invocation of the Emergencies Act in February 2022 uh, to crush the trucker protests in Ottawa. And this was an action that the Federal Court of Canada earlier this year found to be unconstitutional, violating Section 2B freedom of expression and Section 8 charter rights for seizing protesters' bank accounts. And this event served as a pretty striking example to the world of how governance in Canada, which has been a beacon of liberal democracy, has changed. And so I'm very curious, as someone who has been sitting as a member of the BC legislature throughout this time, how have you observed this shift in how we are governed? As a member of the opposition
How
party
do I turn my
in
volume?
2020 and 2021, what were you thinking when the BC government began to act in this way? What were your colleagues thinking and saying? What were you hearing from your constituents? Um, has your thinking about how government has acted during and since COVID-19 changed over time?
So the last part is I'll take first, which is definitely my thinking has changed quite a bit over time. when when I was first elected, we were elected with a mandate of free votes. Excuse me, being able to speak up on behalf of your riding, and that all changed over time. It was very much frowned on, and once we got into 2013, even 20, really around 2017, the party I was part of really stopped having free votes. It was very much, you've got to vote along the party lines, or you were discouraged from being in the chamber. When COVID hit, nobody really knew what was going to happen. We saw the stories on the media, all of the horror stories that were being told, and so everybody was pretty worried about what was going on. And so when the mandates started coming down, when the process started coming down, it became one of those things where we started thinking, okay, how do you oppose this when you don't know what the information is and what's going on? So as a party, there was a decision to hold the line and to support what the government was doing. It was shortly after that I had a conversation with Dr. Bonnie Henry, and then realized that, wait a second, something doesn't seem to be quite right with this, especially when we got into the mandates on vaccines. Now, I've had 3 shots of the vaccine. I wish I hadn't, quite frankly. That's one of the things that's changed in my thinking. The so-called vaccine, the COVID mRNA, shots. When I talked to Bonnie Henry about it, I started to realize that it wasn't so much about trying to get herd immunity or trying to stop the spread, but it was more around shaping opinion and control on the population. And that really became evident when I started talking to her about what happens after. So I did talk to her about the fact that we're going to have to live with COVID forever. It's going to be around. So when are we going to be transitioning into just it's part of life. It's part of what we're going to have to go along with. And she said to me at that time, she said, well, she was hoping this was in 2021. She said, I was hoping it would be in the fall, but now it looks more like it'll be spring of 2022. I think that was the timing of it all. Then at that point, I asked her about healthcare workers, and I said, well, once we move beyond, are we going to be hiring back our healthcare workers? And she just flatly said no. And I said, well, why? And she said, well, because if healthcare workers aren't prepared to take the vaccine, then they probably shouldn't be working in the healthcare field. In other words, it wasn't about patient safety. It wasn't about site safety. It was about ideology. It was about what her opinion of is who should be working in the healthcare field. So all of this, of course, shaped a lot of my thinking around this. Didn't make any sense to me that 600 people could go into a Costco, but 50 people couldn't get together in a church. It didn't make sense to me that 600 people go into a Costco, but small businesses had to shut down that might have 2 or 3 people in a small business. So it was that point that I started, pushing back and asking questions about it. And of course, within my party, there really wasn't any room for being able to do that. And when 2022 rolled along, and I'm sorry for the long answer associated with this, but when 2022 rolled along, it was a challenging year, and there were some questions, particularly what the federal government was doing around the climate change and their agenda around the farm emissions reduction strategy, where they want to reduce or eliminate the use of nitrogen-based fertilizer and stop cows from farting and belching because somehow that was changing the weather. That I started really asking questions about this, and that was when I decided I couldn't get a conversation within caucus. Tried for many months, and finally I was kicked out for putting a retweet out. Fast forward then to the next spring, there was a motion that the NDP had put forward condemning the freedom movement, condemning the freedom convoys, and supporting all of the actions that were taken by government to counter what was going on with COVID and all the actions that they had done throughout that thing. I used some political wrangling to actually force that to a vote in the legislature. I spoke against it and forced it to a vote.
This is the final boarding call.
Sorry for the overhead. In any case, I was surprised, quite frankly, when I was the only person to vote against that motion in the legislature. The party I was formerly part of had voted in favor of the NDP motion, but there was probably 7 or 8 MLAs that couldn't get themselves to voting on behalf of it. So they made a decision to tell them to not be in the chamber, to leave the building. And so that's what they did. One of them actually gave me a call and said, "Hey, I don't have to be in the building. Do you want to go hit some golf balls?" And I said, "Well, there's a vote." "Oh, yeah, that's right. You'll have to be there for that vote." And off they went. And that's, to me, is sort of a typical of what had happened during that period of time. There wasn't any allowing of questions. There wasn't any allowing of statements. There wasn't any allowing of independent thinking. Certainly wasn't any allowing of independent voting.
Yeah, it's been an extraordinary time, extraordinary shift to see that happen. Those of us who have been working in government and or healthcare, it still kind of boggles the mind. Um, and so, vaccine mandates during the past 4 years have become a highly political and one might say successful wedge issue. Um, In fact, there was an entire federal election run on this issue when the Prime Minister in 2021 called an early election and ran on a campaign of vaccine passports, medical segregation, and banning Canadians who did not receive COVID-19 vaccines from traveling on planes and trains with those who did. It seems like this wedge issue still has political currency in BC, as the provincial government has decided to maintain its 3-year-old COVID-19 vaccine mandate for healthcare workers, despite being alone in North America as the only jurisdiction to do so. What is your position on vaccine mandates for employment in the public sector, and will 2024 be another vaccine mandate election in BC?
I don't know whether it'll be a vaccine mandate election. I think most people have kind of moved on, don't want to think about it. I think a lot of people are frustrated. Many people feel they were duped, cajoled by government. So my position on the vaccine mandates is, should I have the honor of forming government, we will drop the mandates on day one of forming a government. They do not need to be in place. We will be looking for a new chief medical officer in this province. Bonnie Henry, from my perspective, should not be in that position. And we will be offering a job back to any of the healthcare workers who would like to come back and work with us in British Columbia. In addition to that, I think what we will do is put together a committee to review the damages or the losses that healthcare workers have had to suffer through in terms of lost wages and what have you, and look at putting some sort of compensation package together for the healthcare workers. I mean, I think of an example of a nurse in Mackenzie, and she was told she had to take the vaccine or had to take these mRNA shots to continue working. She took the first shot. She had a serious reaction to it. And so her doctor advised her, please do not take a second shot. She lost her job because of that. And I just think, that was wrong. So many others lost their job because of that, is because of not wanting to take it as well. I think that was wrong. And when there's a wrong done by government should be brave enough to be able to step up to the plate and try to correct that wrong.
All right. Well, I think, some of our members will have maybe more questions related to that topic when we open it up. But I just wanted to ask you generally, the Conservative Party of BC has seen tremendous growth since you became its leader. You're polling now in second place behind the BC NDP. Some polls have even had you ahead. And you have a significant lead over the third place party, BC United. What are your party's key priorities for BC? What can BC public servants be expecting to work on if your party forms government in October?
We've got about an hour or two for me to go through all of that. I think
whatever you like, the highlights.
Well, there is an awful lot that needs to change. I mean, that's just the bottom line. And I don't look at it as being conservative or liberal or NDP or Green. It's just to stand for what's right and make sure government's focused on the average everyday person. But I'll talk specifically about healthcare because I think there's a lot of changes that are needed in healthcare. There's only one jurisdiction in the world that I could find that comes anywhere close to following what we do in Canada, and that's North Korea. And you look around at our results, we've got great healthcare workers in the system, but the system itself is in a crisis. The system itself, quite frankly, is collapsing. So you look at other jurisdictions that I think are better than what we do, and in particular, those are our European models, Australia, Scandinavia, which are universal healthcare. In other words, single payer, available and accessible by all, but delivered by both public and private. And I think we need to be looking at moving our healthcare system in that direction. There's a doctor who I'm hopeful will end up running for us, a surgeon, and he would get 8 hours of surgery time a week. Could very easily be doing 20, 30, or even 40 hours, but that was all he was given in the public system. And I think we need to be able to utilize our healthcare professionals to their fullest extent and in the services that can be provided. There's another surgeon that I talked to just last week. He specializes in spinal injuries and neck injuries. Um, he gets one surgery day a month, so two surgery days every 2 months. And in the same facility he's working in, there's another doctor there who gets 12 days a month of surgery time to do gender affirming surgeries. And I just look at it and I think there's a professional who could very easily be doing so much more, but is not allowed within the existing system. And so that's why I think we need change. In addition to that, of course, there's a tremendous amount of work that needs to be done to bring in the more professionals that we have, both bringing back those that were unvaccinated, and hopefully they're willing to come back into our system, but also to be able to attract the professionals we need from outside and to expand training and look at different options around that as well. We are overburdened with administration and administrative tasks. 40% of our nurses, for example, are administrators today, is what I've been told in the system. We need to be looking at making sure that we utilize our professionals to the best of their ability that we can to provide services for patients. I guess the last piece I'll just say on the healthcare stuff. It was about a year and a half ago when the court and Brian Day, with the province and Brian Day were in court. And the province essentially argued that the system was more important than patient suffering. And I think that's completely wrong. I think our healthcare system needs to be focused on the patient and not the system. Obviously, the system has to be functional and efficient, but the entire focus needs to be on making sure that we maximize for patients. So an example of that is a hospital. Let's say a hospital gets picking a number, $1 billion budget. They're struggling to meet that budget. So what do? They close beds. They shut down services and close beds. Instead of looking at patients as being a cost, we should be looking at patients as a revenue generator. So that tells that our health facilities, our healthcare professionals are trying to maximize what they can provide safely and efficiently to patients, as opposed to working within a system of constraints.
A lot of work to be done on healthcare, especially, I mean, we've seen how private healthcare is, for all intents and purposes, legal in BC. Yet we have such low capacity in some areas. The province has decided to send patients to Washington State for
And I think
healthcare services.
just to jump in on that, pay for services is illegal, but private services paid for by a single payer, paid for by the government through universal health care is not illegal. You can do that within the scope of the Canada Health Act. I just saw somebody post about Bill 36. There's a question around that. So maybe if I could I'll quickly touch on that as well, because it is part of healthcare. Bill 36, in my opinion, is an affront to our healthcare system. It needs to go. Because it's going to be fully implemented before the election, we probably can't just completely repeal it, because we need to be able to rebuild the structure of the colleges. So we need to work with the healthcare professionals to design what those new colleges should look like, and how they should function. But the rest of Bill 36, I think we should get rid of as quickly as possible.
All right. So we've got a number of questions kind of popping up in the chat. You just answered one. I will read through some of these first, and folks who would like to ask Mr. Rustad a question on verbally or on camera, just think about your question for a moment and raise your hand, and we'll go to you next. I think you addressed this one already, but I know people be very interested in it because as not-for-profit societies, advocacy organizations, we are fundraising money to support ongoing litigation against the province regarding the whole vaccine mandate issue and termination of healthcare workers and public servants. So if you do form government, become premier, what would you do with regard to those cases?
Well, like I say, I think that depends on the goal of the case. If the goal of the case was to get the mandates dropped and hire back the workers and look at compensation, I think we're able to achieve that quite easily. If the case goes beyond that in terms of looking for fault or some other issues, then I suspect that may have to go forward as well. Although one of the pieces that I think is very important for government is freedom of information. I believe that governments like, and as well as all political parties, like to work in the shadows. They don't want you to have the facts. They just want to be able to provide spin so that they can try to convince voters to support them. I think this is wrong. I'd like to change politics forever. I actually want to get rid of the need for freedom of information requests. I think we should make everything that can be public, public. And the job of the Freedom of Information Officer should be to say what can't be made public. And that would make sure that all information that's possible would be out in the public realm. And it would allow you to be able to judge political parties as well as others within government structures against the facts as opposed to against spin. And I think that sort of information would be very helpful in terms of what government does and whether or not there's issues or information that needs to be taken to court.
Right. Another question, sort of in a similar vein, but now referencing there have been reports of serious increase in health conditions and excess deaths since 2021. Is that something you are interested in seeing investigated? And would you consider adding informed consent to the BC Human Rights Code?
It's an interesting question. I hadn't thought about the adding informed consent, but I certainly feel that informed consent is a key piece to medical treatment. Um, I don't think you should be receiving any treatment before you are informed and give consent to that treatment. Obviously, there might be emergency situations where that could vary. So, just to that side of it, if it needs to be added in, I would hope it doesn't need to be added in because that would just be the standard practice that would be out there in our society. Um, Sorry, the first part of the question was.
It was regarding increased excess deaths
Oh, yes,
and
yes.
health
Okay.
conditions since 2021.
Yeah, I think it would be very interesting to start to see some stats from this Canada-wide vaccine injury line to see exactly what's going on with that. I have met many, many people who have said that they have received injuries from the vaccine. I'm not a doctor. I can't judge one way or the other if that was the case. I've also, known unfortunately some situations where there has been some tragedies of death. There's lots of information that's coming out around the world on this. So I certainly think we should open up and look at these things. I'm not sure if British Columbia should take a lead on its own with regards to this, but I think we should be participating on a broader scale in terms of what's been happening both in Canada and in the world.
All right. Um, so shifting gears a little bit, another question from the chat, and I see we have a couple of hands up, so I want to go to you folks next. Um, could you explain how the BC Conservative Party is or is not influenced by the federal Conservative Party, as well as how the relationship between provincial MLAs and federal MPs works?
Sure. For the NDP, they are one and the same party. So if you're a member of the NDP, you're a member federally, provincially, doesn't matter what province you are or territory in Canada. It's one party. For us, we have no affiliation with any political party, including the federal Conservative Party. Obviously, there are some policies and objectives that are very similar between our parties. I'm very supportive of that, both federally as well as provincially. But there is differences as well. And so, we're fierce and about of our independence. We're certainly not planning to take direction from any other group, either in Canada or even outside of Canada. We think that our policies and approaches should be to do what's best and do what's right for people in British Columbia, regardless of what other jurisdictions, both federally, both nationally and internationally, are doing.
Right. Okay, so we've got a few hands up for questions. So we'll go to folks with hands up next. I'll just ask if you could keep your question in about 30
Attention please,
seconds
customer
or less.
information is
That would be
being
great so we
recorded.
could get to more
Please
people.
go to the viewers information
And
counter
if
and
you go a
record
little
this
longer than
recorded
that, I might
message.
jump in. So we'll go
Customer
first
information is
to
paid to the right of hand. Please go to the
James.
nearest information
And
counter or pick up a courtesy phone for a
if I can
message.
unmute
Thank you.
you, or if our hosts can unmute James so he can ask his
Hi
question.
there.
Hi, James.
Hi there. This is kind of a general question. I know personally, I've met a lot of people that are absolutely disgusted with the way the union hasn't handled any of this concerning grievances and whatnot. Um, Clearly, the union seems to be in bed with the government in enforcing the mandates and everything and not doing anything to anybody to object to that. I'm also kind of a person that doesn't like being told what to do. And, when we get an email from the government union, telling us to go protest against something that's totally against our own ideology. I'm just wondering what we can do or what your reaction would be into, possibly lessening the power of the union. They keep bragging about how they have 90,000 members, but, they're probably catering to about 10,000 people that might have their same ideology. Uh, Personally, for myself, I'd like to see being able to have your union dues going to a charity rather than the union if the union's not going to do anything. So just wondering what your thoughts are on that.
Well, that's not an easy question. I really appreciate that. How about we just go to the next question? I just,
We'd like to hear what you have to
just,
say about
I'm just
unions
joking,
in the
but
public sector in BC.
you know, James, I very much support unions. They've done a lot of good things over the years in terms of working standards and particularly things like pensions, these types of things. However, you're right. I think in many cases, and certainly in some cases, unions have overstepped their powers. For example, when I see a public sector union, whether it's nationally or provincially, spending money on a foreign campaign, or when I see a union, taking union dues for political purposes or other types of things, I start to wonder whether or not that is what a mandate of a union should be, and whether mandatory union dues should be spent on those types of things. And so I would want to have a conversation with members just to find out just what can be done and what should be done. There are some steps that have been taken in other jurisdictions, such as England or many of the various states. I'm not sure whether that's a place where we should go, but it's something that I think would be worth exploring. And I think just to close that off, what I would want to do more than anything is do everything we can to make sure that union, public or private, is doing the job it's there to do, which is to fight for its members and support its members. And if they are not doing that, if they're off, with ideology or other things, that's when I think that there might be an abuse, and that's where government should perhaps step in and take some actions.
Okay. I'd just like to clarify real quick that I kind of speaking as a former union president. So it's not that I'm anti-union. It's if the union's not going to do the job, then there should be some repercussions.
Yeah, well, I think it was 1956. There was the ruling from the Supreme Court. Oh, I think it was the Supreme Court that said, if you're working in a job and you're receiving benefits to the union, it's not unreasonable to pay dues to the union. The question really becomes, where is that role of the union? Where does those mandates change? And so, those are questions I think that do need to be asked and answered.
All right, thanks, James, for the question. I'll go next to Jed. Jed Ferguson of United Healthcare Workers of BC. If our host could unmute Jed, that would be great. See, maybe I can do that. No, I can't. We're working on it, Jed. If you're able to unmute yourself,
Yeah,
give it a shot. There we go. Yeah.
thanks. I'm a little red, guys. I'm a roofer now, so from a healthcare. Quick, it'll be quick. What does that panel look like? Is it going to be a panel between like doctors? Is it going to be people that were fired for the compensation for the healthcare workers? And I do agree that the unions definitely need to be held more responsible, but I do think the unions are very good, but the leadership is bad, just like we know what's going on right now. And are you okay or for a Nuremberg 2.0?
Do it bigger 2.0, sorry?
Nuremberg.
Nuremberg 2.0.
Yes.
Oh, yes. That's probably
I know that's
something
a
that's
hard one.
outside of my scope.
I know that puts you on the hot
Yeah,
spot right there for
yeah.
sure, but I had to ask.
That no, it's fine. It's like I say, those are something that's sort of outside the scope in terms of a jurisdiction of British Columbia. But if we would certainly be participating with other jurisdictions as we look at those sort of issues. So the panel, what I'm thinking about, excuse me, is some former or some people who are impacted. Maybe some labor lawyers or a labor lawyer around it, and a few other experts in terms of being able to give advice to government. But that's sort of the what I'm looking at in terms of a group that would need to come together. But I have not, given thought to what a final panel should look like. But that's just sort of the things that are in my head in terms of the approach that we'd be thinking about.
Okay, and what about? I mean, you must have obviously heard about the National Citizens Inquiry. Do you think that
Yes.
something that could be used
I think that's.
in
I
the
mean,
future?
they've got a lot of recommendations with it and collected a lot of information, and I think it's very valuable information, and it's certainly something that should be considered.
And I appreciate everything you're doing too. I do.
Thank you. Thank you.
Good question, Jed. All right, so next up is Catherine. Please go ahead.
Hi, thanks so much for being at this meeting. So I have been within the health authority, not anymore, but I had a colleague call me today to say she was at a Providence Health Authority meeting, and she just asked an executive at a big meeting, when are you going to hire back the other employees who didn't take the shots and are still off work? And people have no idea. The executive said, "Oh, I have to, ask somebody else." But my question is really like, how do you get the information more public? Because I think this should be discussed during the election campaign. And I know you've been asking, it gets asked in the legislature, but it doesn't make it to general media, right? Mainstream media. And I'm just wondering what the plan would be to have this come out more, that we're the only jurisdiction in North America. And then you mentioned you want to do some changes. I'm wondering to healthcare. I'm wondering what your limitations would be with the Canada Health Act that like how much can you change given that we have the Canada Health Act that's federal?
Sure. So you're right. It would be nice to be able to get this information out in the public realm more. I think we'll do some advertising and around this as we get closer to the election. Certainly, it'll be a piece that comes out as part of our platform, and we'll look for opportunities to highlight that, perhaps with healthcare workers. So, like I say, it'll depend on sort of the environment in terms of how far we can penetrate that out there. With regards to the Canada Health Act, it's actually pretty open as long as it is universal. That's the key. And so that's why we need to make sure we keep it universal. We don't want to go down the route of pay for service. That's when you start running into all kinds of troubles. Although there is an opportunity to even look at doing some of that under the Canada Health Act. Quebec has been able to do that and managed to get it through the Supreme Court. But I think initially the big key is to set some structural changes within BC to try to create a more positive environment for workers, for employees, create those options that are going to be really focused on servicing the patients and allowing that some time to work through. We really need to look at the health models, the health authority models, as to whether or not they're best. They become very, very administratively heavy. And so I think there's some structural changes we need to be looking at there as well.
Thank you very much.
Thank you, Catherine, for the question. Next, we've got Annette. Annette, how are you today?
Hi. I have two questions. One is, what are you going to do about LPNs that have lost their license through being terminated? And the other question is student loans for owing on the BC and federal student loans. I know you can't do anything about federally, possibly, but for BC student loans that haven't been
Uh,
paid.
so I don't have an answer on the student loan issue, and I apologize for that. It's not something I've really turned my mind to at this point. So it's something I need to learn more of. And so the question is, if you lost your license because you were fired or quit, whatever the case may be, in terms of being an LPN, was that a decision made by the college?
Yes.
Okay, in which case, my hope would be that we could get that reinstated, unless there were some other reasons why it needed to happen. So, but if it was just because of a refusal for the vaccine, I think that should be fine to be able to reverse that. And
Thank
I've
you.
got to charge my iPad. I'm doing this by iPad, so sorry I can't read the text messages, but I've just noticed my iPad is down to 10% power. So if I suddenly cut out, my apologies. I'm not close to a power circuit here. I can see if I can try to find some place to plug it in, but
No, well, thanks for that warning, and we'll try and get to the last questions here before that does happen. So, thanks, Annette, for the question. Timothy, you have your hand up. Please go ahead for John.
Hi, can you hear me?
Yes.
yes.
Okay. John and I actually met at the Reclaiming Canada conference early last summer outside Oak Bay or Oakland's Bible Chapel. You and I had a little chat. So I'm just getting reacquainted here. I have a couple of questions here regarding other institutions other than health and the public health system in BC. And I'll try to frame this as quickly as possible. The first question has to do with an amalgamation of global warming and adverse effects.
Sorry, Timothy. What I'm going to do, I've just noticed our power plug, so I'm just going to turn my camera off for a second and move my setting here so that I can try to get plugged in. Hold on.
If you want to go ahead, Timothy, I think John is still hearing you now. So,
okay.
Yeah.
I'm not sure I want to compete with the airport PA system here.
It's a little loud.
Okay. So in what the NDP government has done is it's released a report on heat deaths in BC in 2021. And if you look at those numbers, they're amazingly coincident with the peak in adverse events following immunization from BC CDC. I wrote to the coroner's office and I asked them, did you bother to look at the possibility of a connection between adverse events following immunization with COVID-19 vaccines and these heat deaths? And although I received an acknowledgement of that question, I never got any kind of response back from BC Coroner Service.
Sorry,
I am really concerned.
Don't want to cut you off, but we do want to get to other questions I have in the chat. So if you're able to put the question to John,
I just want to point out that there appears to be other institutions that are involved in messaging here, whether or not this is actually occurring, that I think they need to be looked at. The same thing with WorkSafe BC. WorkSafe BC declared COVID-19 as a reportable disease in the summer of 2021, on par with other industrial diseases, which meant that workplaces had to report an outbreak of COVID-19 if it occurred in the workplace, and that the workplace, these institutions are simply padding the statistics and creating a situation that makes things look worse than they actually are. And the messaging involved, I find disquieting, and I'm wondering if there's if Mr. Rustad has any inclination towards investigating these institutions or looking into the ways these institutions have been used by the BC NDP to focus messaging to create the perception that COVID-19 is worse than it actually is. Does that make any sense?
So that's you're absolutely right. I think institutions have done that. And that's part of the reason why I want to change things like freedom of information and get all the information out there so that it's not about spin, but it's about facts. For another thing, for example, British Columbia does not keep track, or if they do keep track, they don't make it public, how many people that are on waiting lists for diagnostic services or surgery pass away every year. It's collected federally, but it's not available provincially. And at least not that I could find. Maybe it is available, that's buried. But the last number I looked at is about the same number of people are dying every day while waiting for diagnostic services surgeries as are dying from the opioid crisis. And yet nobody talks about it. It's not available. It's not there. So there's no question that there's information that is being withheld or information that has been manipulated in terms of how it's reported to further an agenda, further a narrative.
Thanks for that question, Timothy. There's another one in the chat that is kind of in a similar vein, and maybe I'll just read it out, but it does kind of speak to or ask rather what you would do institutionally, I guess, within government should you become premier of the province. And I'll just read the question out. Mr. Rustad, I've been re-employed with the BC Public Service after being placed on a 2-year leave without pay for not complying with the vaccine mandate. Being inside government, again, I see many of the senior executives at the deputy minister, assistant deputy minister, and executive director levels openly support and drive the current NDP agendas. If you form government, how would you navigate this carryover of past ideologies from existing BC Public Service leadership?
The NDP have done a lot of hires through the system. I think we'd have to have a critical look to make sure that people are there not based on their political ideology, but they're there based on doing the job of the public service. I've worked with the public service over the years, and I'm actually, I can say that many of the people, if not all the people that I've worked with in the past, have got a good heart. They're in the right place trying to do the work they're doing. There's some, of course, that have their own ideology. And this is always a challenge. I was reminded about this when I was a school trustee, that it's the politician's job to lay the tracks, and it is the bureaucrat's job to drive the trains. And it's always get in trouble where you see those two, where the politicians try to drive the trains or whether you get the bureaucrats trying to lay the tracks. And so making sure that we've got a public service that is capable of doing the job that needs to be done is, of course, got to be a priority.
Thank you. We've got one more question here with a hand up from Tammy. Tammy, if you'd like to ask Mr. Rustad your question.
Yeah, thanks. I'm just wondering, it was mentioned about hiring the healthcare workers back, but what about us, excuse me, us, the public servants who also lost our jobs and are still fired?
Yeah, I had thought there was employment offered back. If anybody that also from the public service that is in that category would, from my perspective, would certainly need to have their jobs offered back unless there was some other reason why that's not happening.
Yeah, no, if we were fired, we didn't get offered our job back.
Okay. I was talking to some that did that were fired and got the job back. Can't remember. I'm pretty sure that was the case. So maybe that hasn't gone across the whole system. So you're right. That's something that does need to be looked at as well, then, for sure. Thanks for that question.
Okay, thank you.
Well, we've got a few minutes left, John, so there's still some questions here in the chat, and I will read them out. This one not having to do with employment, but rather with education curriculum. As a mother of two children, aged 12 and 10, I've seen firsthand the shift in my children's school in Cloverdale. The introduction of the SOGI curriculum has become a high priority within the school teachings. I have now had to make the difficult decision to remove them from the public school system and place them in a private Christian school. My questions are, is the SOGI curriculum an issue that you will address if voted in as premier? And is your party in agreement on whether this curriculum should remain in schools, especially elementary schools? And if not, how will you address differing views within your party on this controversial topic? Thank you.
Sure. So we've been on record very clear on this particular issue. We are not interested. SOGI's got to go. It's too divisive. The sexualization of our kids in school has to come to an end. Our entire education system actually needs to be gone through with a critical lens of making sure that everything provided, everything taught to our kids, our students, is about teaching kids how to think, not what to think. And so there's a lot of material, a lot of things that we need to go through to make sure that our education system is doing the best job as possible.
All right, thank you. I'm going through the chat, and I think I have touched on all the substantive questions that we haven't talked about already. So if anyone has a question they'd like to ask, the floor is open. And I know it is getting late, so I don't want to keep you too long, John, and I know you're waiting for a plane. When is that plane coming, by the way?
So I start boarding in about 5 minutes.
Okay. Well, okay. I see one hand left, so this will be our last question. And it's coming from Mike. So Mike, you've got the floor. If you can unmute, Mike, we can't hear you. Still not hearing you, Mike, and I'm not sure I can't unmute you, so give you another second or here. You can manage that mute button.
I can't seem to unmute him either there, Phil.
Okay, thanks, Dale. Well, there is another hand, so Rob will be the last question. Rob, please go ahead. We can get Rob.
Hi there, can you hear me?
Yes, we can. Thank you.
Okay, great. Just a quick question, Mr. Rustad, regarding those of us that were forced into early retirement because that became our only option when the second mail came out informing us of our impending termination. So that, for many of us reduced our pension years plus the wages that we would have incurred. So I'm just wondered if you could speak to that. Thanks.
Yeah, that's a tricky situation there, and I'm not sure how to handle that, Rob. I wish I had a better answer at this stage. I'm not, like I say, I don't know from a labor perspective or even from a what's right perspective. So it's something that would have to be looked at. I think it's probably something that that group would have to look at in terms of how to address that situation. Certainly, from my perspective, anybody that we could possibly get back into the healthcare system, we'd love to have back. So hopefully people in that situation might want to come out of retirement and work back into the system working. But other than that, I don't have an answer. I'm sorry.
Yeah, would it be something that your government would look into as into those that were forced out, because not just about the healthcare workers, there were many other sectors of government affected.
Yes, I agree. So that is something I would like to look at. Like I say, from my perspective, it's just to make sure that we're doing what's right and that people have been treated fairly. And, the situation you described obviously is not something that I would have considered to be fair treatment of an employee of the government.
Great, thank you.
All right.
So with that, thank you very much for the opportunity to join you here. Sorry we couldn't be longer, and sorry I wasn't able to read the questions and comments and things that were in the chat. It just working on an iPad just didn't make it available for me to be able to do that.
No, well, thank you, John, for your time on behalf of both the BCPSEF Society and the United Healthcare Workers of BC. We appreciate the time you've taken out. We hope your counterparts and the other parties will take up our invitation to speak to us as well. So maybe if you see them out there on the campaign trail, put a good word in for us.
Well, if they haven't talked to you by the time the campaign starts, please let me know, and because I would love to make sure that I harass them about that during the campaign.
Well, we appreciate that. Thanks very
All right,
much, and have
take
a
care,
great
everybody.
night.
Thanks for taking your time tonight.
Thank you. Bye-bye.